First of all, a huge welcome to Solving from Anywhere. I am thrilled to be hosting an incredible group of speakers today on a topic that's not only relevant to everybody who's on this webinar, but to everybody around the world in this moment: innovation in global health and vaccine development. If you're new to Solve, a special welcome to you. Let me give you a little bit of background. Solve is an initiative of MIT, and our mission is to drive innovation to solve world challenges. To do that, we host open innovation challenges through which we find, fund, and support social entrepreneurs that we call solver teams. We connect those teams with our community of members who then support them to further scale their impact and their work. We hope that you enjoy today's introduction to Solve's community of entrepreneurs and social impact leaders. Solve is lucky to count so many foundations, corporations, and nonprofits as members. Our community has grown over the past several years to over 120 member organizations who achieve their social impact goals through partnerships with Solve and our solver teams. They provide funding, employee support, in-kind resources, thought leadership, and strategic partnerships. We couldn't do what we do without them, so thank you. Now, before I dive into today's panel, I have an exciting sneak peek to share with all of you. Tomorrow, which is Wednesday, September 2nd, we will be publicly announcing the incredible finalists from our 2020 Global Challenges. So keep your eyes open for our newsletter, The Crowd Solve, to hit your inbox tomorrow. On that note, if you're a member of Solve, please also don't forget to register for Solve Challenge Finals, which is taking place virtually this year on September 29th. Solve Challenge Finals is where you'll have a chance to hear from the 15 finalists for each of our 5 global challenges: sustainable food systems, learning for girls and women, good jobs and inclusive entrepreneurship, maternal and newborn health, and of course, health security and pandemics. The most promising solutions will join our community as our next class of solver teams, and they'll have a chance to access over $2 million in prize funding. Solve Challenge Finals is open to our community of members and solver teams. So if you're interested in coming, but you're not yet a member, please do reach out to us. We would love to hear from you. All right, so on to today's session. Today, we'll be hearing from one of our 2018 Frontlines of Health solvers, Temi Giwa-Tubason, the founder and CEO of LifeBank. LifeBank is an organization that combines data, smart logistics, and technology to deliver life-saving medical products, and they're based in Lagos, Nigeria. We'll then be joined by Dr. Vanessa Carey, who is the founder of Seed Global Health and an associate professor and director of the program in global policy and social change at Harvard Medical School, and Dr. Taryn Rogalski-Salter, head of the Global Regulatory Strategy and Operations at the Gates Medical Research Institute. Vanessa and Taryn will join Temi and me on stage for a broader conversation about action and innovation, not only to accelerate the creation of a vaccine for COVID-19, but also, and very importantly, how to disseminate that vaccine to those that need it the most around the world. We want to be hearing from you throughout this conversation. So take a look at the bottom of your screen where you'll see a little Q&A button. As questions for any of our speakers come to mind over the next hour, please input them there or on Twitter using the hashtag #SolvingFromAnywhere. You can also upvote your favorite questions, and then during the last 20 minutes of our session, we'll focus on audience Q&A, and I'll try to get to as many of your questions as I can. Okay, without further ado, I am thrilled to introduce Temi Giwa-Tubason, founder and CEO of LifeBank. As Africa's healthcare supply chain engine, LifeBank helps hospitals discover essential medical supplies and delivers them in the right condition and on time. Temi, thank you so much for joining us.
Thank you, Pooja, for having me. I'm very glad to be here.
Very excited to have you. So I would love to have you begin with just a brief background on yourself and on LifeBank. And I think everyone's going to be anxious to hear how the focus of your work at LifeBank has changed as a result of COVID-19.
Absolutely. LifeBank is a medical distribution company. We deliver critical medical supplies 24 hours a day, 7 days a week in developing countries. We are present in Nigeria mostly. And before COVID-19, we were basically focused on delivering medical supplies in emergencies in certain areas in Nigeria. Mostly urban areas where there are a lot of urban poor folks and peri-urban and a couple of peri-urban states. Before COVID-19, we were in 3 states across Nigeria. We were delivering critical medical supplies specifically for private hospitals and some public institution. So we were focused on growing and getting large and delivering impact at scale before COVID-19, and primarily focused on blood and blood products to help save women during childbirth, and then also a little bit of emergency medical oxygen delivery in urban areas. So that was LifeBank pre-COVID-19. And we were really, we had a plan, we had a strategy, we were slowly but surely, implementing that strategy, looking to expand outside Nigeria and growing, slowly but surely. But COVID hit, and I think like most people in healthcare, it was a reset. It was everything came to a standstill, and we had to make a choice. Do we continue operating the way we've always operated, or do we change our model to respond to the time? Or do we take what we've built and use it to help to respond to COVID-19 in a way that saves life and that can reach the most vulnerable at the last mile. So we chose the third option, which was to use our capacity, our ability to execute, our ability to build quick supply chain system that can deliver cold chain supplies. Blood is a cold chain product. It has to be kept cold. Do we use that expertise to deliver testing kits, other critical consumables that have to be maintained in a certain condition? Do we use our expertise on medical oxygen in emergencies to deliver, to a larger scale and to the last mile? So we chose the third option. Immediately COVID hit, we built the first mass testing center in Nigeria. We built it in Lagos in partnership with public institution, and we made it absolutely free of charge for the patients. At the time, COVID tests were quite expensive. It was very hard to do, but we responded to the moment and built a testing center. Then a couple of weeks later, we went to another state, the second largest state with the highest COVID, but the second largest COVID burden in Nigeria. We launched another testing center there and responded to ensuring improving the capacity of the health system there to respond to COVID-19 by testing significantly. And later on, we started looking at how do we expand access to medical oxygen? How do we deliver medical oxygen to the very last mile? We were looking at how do we gather inventory information around ventilators, respirators, ICU beds in our country, and how do we make this information available to the health workers? So we really focused our attention on building that institution, that critical infrastructure that would help the health system respond to this medical emergency. And it's been incredible. I think that, I like to say that we've built at least 4 different products since COVID-19 hit, and they've all been incredibly impactful and really could meet the demand of what the country needed to respond to COVID-19.
It is really admirable how you have pivoted so quickly and just been able to be responsive to the needs in the country. I'm curious to hear, you talked a lot about how you're responding to COVID, but what about this moment, if anything, has inspired change to your actual model? So do you anticipate changes to LifeBank going forward?
Absolutely. Of course, your model, before COVID, we were primarily working with private institutions and charging accordingly. We still work with some private institutions which serve the urban poor, but mostly we responded, we worked with companies in the urban center who were treating patients for critical diseases. So when COVID hit, we knew we needed to get to the last mile. Now, to get to the last mile, your model needs to adjust slightly so you can help people who may not have the purchasing power to purchase the services that they actually desperately needed. So we had to respond to that by making sure that we can partner with public sector and also the private institution who have the funding, the financing to work with us. So we partnered with banks, we partnered with local paint companies. We partnered with everybody, and we were able to bring everybody together. We brought public institutions, people who were on the front line. We brought private sector with the capacity to pay, and by bringing everybody together, we're able to reach the most vulnerable members of our community at the most vulnerable place, at the very last mile, in those clinics where they don't get access to resources, people don't have purchasing power. We're able to partner with everybody in our country to really help to respond to this medical emergency and reach the last mile and be impactful for them. Get them testing, get them oxygen when they need it, get them critical medicines when it's necessary. But also, like I like to say, COVID-19 didn't, babies were still being born, and, people still need blood and blood products. People still needed oxygen. So we needed to keep, so it wasn't a complete pivot because our day job, we still had to keep that running, and we still had to make sure that we were still delivering blood and blood products round the clock, 24 hours, 7 days a week, even in a lockdown. But at the same time, still build institutions, still build infrastructure that could get to the last mile.
Thank you. It's really inspiring to hear always the massive strides that you're making in your work each time that we speak. So thank you for sharing that. Don't forget, for our audience, you can start submitting your questions for Temi using the Q&A function at the bottom of the screen, and you should stay tuned for your questions to be asked at the end of the session. So for the next part of this conversation, I would like to welcome our next two speakers onto the screen. Dr. Vanessa Carey is the CEO of Seed Global Health and an associate professor and director of the program in global public policy and social change at Harvard Medical School. Welcome, Vanessa.
Thank you for having me.
And we have Taryn Rogalski-Salter. She is the head of global regulatory strategy and operations for the Gates Medical Research Institute. Hi, Taryn.
Hi, everyone. Thank you for having me also. It's great to be here.
So lovely to have all of you here. So Taryn, I would love to start with you. You have been working in the regulatory space for decades now. Can you tell us a bit about what the day-to-day of regulatory affairs in vaccine development looks like? I'd be particularly interested to hear about your experience navigating global vaccine regulation and its complexities, especially during this time that calls for rapid innovation and rapid development and rapid deployment.
Absolutely. Well, it's a pleasure. It's very difficult to follow Temi in that excellent presentation and just to see the flexibility of the system that she and her team have built, be able to bring that innovative approach to areas that really need it. And that's something that's very important for us at Gates Medical Research Institute. All lives have equal value. Innovation should know no borders. And we should really look holistically, especially with infectious diseases, because they know no borders also. Infectious diseases travel seamlessly around the globe, as we've seen over the past few months. And we really need to think about the end in mind, and Temi's, terminology of that last mile, and how do you bring products that very last mile is so very important. But I'm really happy to talk about regulatory affairs, and I have to watch the clock because this could go on for hours. But maybe some of you on the line are very familiar with regulatory affairs. Maybe you've worked in the discipline. And what we do in RA, in regulatory affairs, is we are, I would use the term integrators. Maybe that's more of a business type term, but we bring together very disparate functions within a company or within a nonprofit. We bring together data sets, and then we put those data sets together in a very cohesive and logical and time-bound format so that you're very clear regarding the development of the intervention, whether it be a vaccine or a medicinal product, plasma, etc. And so what we do is we work across all functions in clinical, in non-clinical, in the manufacturing function, in the policy function, because that last mile also sometimes depends on policy recommendations and medical recommendations and standard of care. And also, we have to think about, what are the payers looking for? What are the nonprofits looking for when they're thinking about donating money? How can we then devise our development program to meet those needs, the very, very disparate needs? So we work together with clinicians, we work together with engineers, we work together with bench scientists, because we need to know how the product was developed, how it was discovered, and we actually pull all this together. And the innovative approach is to make sure that when we pull together what we call a dossier, it really is describing the candidate, and we submit that to the health authorities. We really like to see that there's harmonization in requirements, that there's an understanding of the testing requirements for the product, and also that the end result is matching what the product should be doing across the globe. So working together with regulators, understanding the regulations and putting that into practice is something that we do every day.
Thank you, Taryn. It's clear from everything that you're saying that you're thinking globally as you think about this, which is something that's necessary as we respond to the current health crisis. And Vanessa, I think that's a really great segue into the work that you do. So currently you're advocating for building what you call a global immune system through your work at the Global Public Policy and Social Change Program at Harvard. Talk a little bit about what that means and how that would actually reshape our current approach to vaccine production and delivery, both during COVID, but then also beyond.
Thank you. First of all, I just want to thank you for having us all as part of the panel. And it's really terrific to hear both about the work that Temi is doing and what Taryn is doing. And to lead off of what Taryn said before, which is that, infectious diseases don't know any boundaries. And so, but it's not just infectious diseases, it's frankly all health problems and all health systems. We have the largest number of displaced people in history now moving. And a lot of this is being driven by people's safety, security, access to health resources, strong health systems. And what the idea of a global immune system is that it's really a network of, health systems and institutions that are designed to protect the human population from health threats and emerging diseases. And that when you have holes in those systems, fragile states, weak health systems in countries, it really threatens not only the health gains that some countries and populations have made, that we have made as a globe, but it really leaves us globally vulnerable to infectious diseases, bioterrorism threats, increased numbers of refugees, movement of people, migration, the health impacts of climate change. And so really what we're talking about is this idea that health is fundamental to our global well-being, both on an individual level, a community level, a national level, and a global level of security. And I don't think anything in history, you could say the Spanish flu, I guess, did this in the early 1900s, but COVID has illustrated this for us more so than almost anything else. It's just a really stark, extraordinary scale idea of how vulnerable we are to the health and well-being of what happens maybe in a small community in one country that can become a global threat. And that means that we have, and I'm sorry, there's a little bit of background noise, that means that we really have a responsibility to think about health problems as a global problem. And it's our global community that we need to solve it. And so whether you are solving a last mile issue of getting oxygen, to a state in Nigeria to deliver care to the most vulnerable people there, or you're talking about our health and well-being in the United States or in France or in China or in Indonesia, we're all connected. And so what that means for a global vaccine is if you look at the competition for a vaccine right now, there's been a lot of effort to buy up vaccine doses, right? We're going to immunize. Let's just take the United States, for example. There's been an idea that we will just immunize 100% of the US and then we'll all be safe and be able to go back to business. Here's the reality, though, is that you can't go back to business if your population where you are manufacturing things or where you need your resources is vulnerable. You can't go back to business if you're going to have a huge influx of refugees coming over your border because they are vulnerable. So the idea of making a vaccine, or all health really, a global common good, is that we are all impacted by the health of people, no matter where they are. And for a vaccine, this is critically important, because immunizing an entire country 100% is not going to be what is going to make that country safe. What is going to make us safe is if we hit a basic threshold of immunization across all countries around the world, so that you are getting the most at risk of being sick from COVID, and the most vulnerable population, and your healthcare workers. And what that means is that you can suppress the infection rate low enough to disrupt the rates of transmission that we're seeing today. And you also can ensure that you have a strong and robust healthcare workforce able to care for that population that not only gets sick from COVID, but continues to have babies, continues to have strokes, continues to die of malnutrition or diarrhea or pneumonia or cancer. Our leading causes of death around the world today are cardiovascular disease and malignancies, for example, are two of the top three. So COVID is just disrupting our health systems and dismantling our ability to take care of those. Babies are still being born, and women are still dying. So we need to address those issues too. The work that I also do at Seed Global Health, the nonprofit that I run, we focus on training healthcare workers in partnership with governments, recognizing that healthcare workforce is critically essential to address some of the most pressing health needs that we have. Because if you're going to deliver that oxygen, and you're going to be able to give HIV meds, you need a healthcare workforce to deliver it. And so all of these things come together into this concept of a global immune system and the need for health and our remedies for health to be treated as a global public good.
Thank you, Vanessa. That's a very logical way to think about it. And I hope that you're making great strides there in that advocacy work. So even if we're able to develop a vaccine and get it through the regulatory processes, as Taryn talked about, and then we're able to distribute it globally, as Vanessa talked about, Temi, we still need to get it out to the last mile, because Vanessa just talked a lot about how unless we have widespread immunization, it's not going to make a difference. Can you tell us a little bit about LifeBank's efforts to use the cold chain that you're setting up to help with that vaccine distribution process?
Right, thank you. And I was just nodding as Vanessa and Taryn spoke. I think that, it is really critical to do this work in a way that builds an entire system. So like, Vanessa mentioned, there's so many different issues that our health system are facing. And there are many, many things that are still occurring. Malaria is still killing people, maternal mortality is still available. And it's really critical to build a system, a holistic system that will allow us to solve a lot of these problems that ends up, affecting people's lives. And for us, there was a very popular song when COVID hit Africa, where a bunch of young people across the continent sang a song that said, no one is safe if everybody is not safe, and that's the reality. We are all, a tiny village in northern Nigeria, in southern Sierra Leone, in northern Liberia. Can, an issue in that tiny village can become a major problem for the rest of the world. So it's absolutely critical to get these vaccines to everybody. We need to get this vaccine to the last mile. As we're developing it, it has to be equitable. We have to build a system that allows that equity in terms of access to this vaccine and actually translate it to the reality. There's a lot of rhetoric about, we have to make sure that everyone is safe. We have to get it to everybody that needs it. But a lot of times we need to go, how do we actually do that? How do we break it down? And it is really supporting and investing in distribution system that can be deployed and can move these vaccines from the ports when they land to the clinics, to those tiny primary health centers in tiny villages across Africa, across Asia, across South America, and across the entire world. So I think it's really critical. And the work we're doing is preparing ourselves, preparing the supply chain that we've already built, that distribution system that is deploying technology, that's deploying critical last mile distribution, machines, trucks, drones, bikes. And I have a very interesting picture that captures what it will take to actually get these vaccines to the very last mile. If you can present it, Roland, it's a full suit of distribution might to get this vaccine to the last mile. And what we need from the global community is to support and invest in in critical infrastructure play, like the kind of thing LifeBank is doing. We're trying to use LifeBank as an example of what's possible when global parties, global institutions support local entrepreneurs who know exactly how it is and what it's going to take to get this supply to the last mile. Sometimes it's going to take a boat. Sometimes it'll take a small, tuk-tuk. Sometimes it's a motorbike that would actually get to that last clinic. Sometimes it's a drone, sometimes it's very high tech. And sometimes it's as low tech as just a truck, moving from point A to point B. But it's absolutely important to build this flexible, smart distribution platform that can deliver COVID vaccine, but not just the COVID vaccine, like Vanessa mentioned, that can also deliver, while delivering COVID vaccine, that can move blood, that can move oxygen, that can move medical samples. And I think it's really critical to build this holistic system. And that's what LifeBank is trying to show. That's why we're so passionate to tell our story and say, this is how we do it. This is what you need to invest in to get to the last mile and make sure that the impact we're trying to drive is sustained.
I actually just double down on that, because I think exactly that philosophy of the fact that for a marginal smaller investment, if you can deliver a comprehensive set of services than just say a COVID vaccine, if you can think about how you leverage that wider response, our impact would be that much more profound. We have multiple times throughout history where we have responded to an epidemic or a crisis very myopically, looking only at that crisis and not looking at what we could do that would be that much bigger. We could have built entire primary care systems that delivered all the way down to that last mile, preventative, full, and comprehensive services. But instead, we built beautiful and yes, very effective HIV clinics, right? But they're next to crumbling primary care centers. And there isn't that ability to necessarily provide that full services. And so I just want to really second the power of what you just said, Temi, in terms of being able to do it, and to thank you for taking such a comprehensive response.
Thank you.
And if I can make one comment from the regulatory perspective, and so Temi, just what Vanessa said, I can't echo or say it any better, but just to have knowledge so that when the vaccine developers, when the medicinal product developers know that your product may end up being delivered in a drone. Think about the delivery of that vaccine. Should there be some delivery that maybe doesn't require a trained healthcare provider? Think about how we can do all these things differently, even down to the packaging material. So when you're designing the box that the vaccine vial goes in, you don't want a big box because it may be in the belly of a drone. You want to make sure that you understand the thermal stability of your product, you understand the packaging, and then you try to facilitate delivery, looking at novel delivery mechanisms. So we're all saying the same thing, and just having this knowledge and the integration of this innovation into development would be quite important. So thank you.
Thank you. Taryn, just to continue with you. So I think we are hearing over and over in this conversation that even though we need to solve the issues that are most pressing regarding COVID right now, every other health issue that we were facing before COVID is still continuing, both in terms of what we need to address through primary care, but then also, other pressing diseases that we need to continue developing vaccines for. So can you talk a little bit about the tension, how that tension is being balanced by regulators who I think we've also talked about previously are not only balancing that, but are also kind of working overtime. They're risking exposure as they make sure that they're getting to work to get these vaccines out and approved. Talk a little bit about that.
Yeah, thanks for the opportunity. And I just, this is from the outside looking in. I don't have firsthand knowledge of the day-to-day activities of a regulator, let's say in an FDA-like environment. But as Vanessa said, cancer doesn't stop. As Temi said, babies are still being born. We still need to look at new innovations, new medicinal products. They need to get through the regulatory system. That can't stop. And on top of that, we have all of the challenges of COVID, looking at new indications for existing products, looking at brand new products that could stop the virus in its tracks, and then looking at vaccines. And so this work was really placed on top of the already significant workload just that is happening every day with respect to the regulators and the review of dossiers. As I mentioned before, that's the compilation, that's the description of the product, and then making sure that you make an informed and benefit risk-based decision on the ability or the approval of that product. So all of this is still happening. And I can give you, one example or two examples of how the regulators are looking at this and how they're communicating with developers. So there's one group of regulatory professionals. It's called ICMRA, I-C-M-R-A, and that is the International Coalition of Medicines Regulatory Authorities. And they started working and they formed position papers on things like what is the non-clinical testing that you would need before you put a vaccine, a COVID vaccine in the clinic. They publish those on their website. This is all extra work, and it's so transparent, and it speaks to harmonization, what I mentioned before, so that you don't have to redo steps in development. You have a harmonized approach across the globe with the regulators. It's very important. If we think about the continent, we think about what's happening in Africa, there's something called AVAREF, and AVAREF is an incredible organization of regulatory authorities across the countries in Africa and health and ethics committees. And these are the people that are approving clinical trial starts. And AVAREF also has a great website that you can look at, but they're learning about COVID. They've changed their policies so that they're responding to COVID-related applications so quickly, along with doing all of their other work. So I thought it was important to call this out. We're all in this together, as Vanessa said. We really need to work together, learn together, and institutionalize these learnings so that when the next pandemic comes, when the next crisis comes, we're able to reactivate and not make maybe the same stumbles as we've made before. Let's take the best and let's document it. Pooja, you were funny when you said that I've been in vaccines for a while. So I can remember back in 2009 with H1N1 and how we were learning then with an influenza pandemic and how we worked together and how those lessons learned, even almost 20 years later, are still being, at least 10 years later, are still being looked at. So that's it from me on this topic, but it's something that we should document and we should be aware of so that the next time we can be even more responsive. Thank you.
Thanks, Taryn. I would like to address a similar question actually to both Vanessa and Temi. So as you might know, within Solve's Health Security and Pandemics Challenge, we're focused not only on solutions that could address what's going on right now, but also longer term solutions, because we know this will not be the last pandemic that affects us. And we need to figure out ways that we can more effectively mitigate the impacts that, both now and in the future. So I would love to know from your perspectives, how we ensure that the various innovations that we're building now are actually permanent, proactive solutions for the future and not just one-time solutions that just apply in this moment. Vanessa, maybe we start with you.
So I think this is always the great challenge, right? Is how do you get solutions that work, right? So that's the important thing. The philosophy we very much have taken at Seed Global Health is that our job is to support our partners and our partner governments and the partner institutions where we work to meet their priorities and to achieve the goals and to close the gaps they identify as being critical. And so I think by the nature of the fact that our work is very much there to kind of co-collaborate, to support, to solve these health problems and to train, there's a sense of it's their projects, right? And I think that helps, is that historically a lot of solutions come from the outside and are funded from the outside. There's unbelievable power dynamics at play, colonialism, racism, that have all been kind of dictating, what solutions are over time. And then when the funding runs out, capacity hasn't been built. There's no sense of ownership. It isn't integrated into the community. It may not be culturally sensitive. It may not be. And I think that it's really important that when we are thinking about solving health problems, we are really starting on the ground in a really intimate and real way and understanding what are the challenges to solving that problem there. And how do we do it in a way that supports the folks, the places that we're working to do it in a way that they see as the right way, in the way that that fits the community. And I think that that's step number one. I work at the intersection of public policy very much. And so when we are doing our work at SEED or at Global Public Policy at Harvard, our viewpoint is that as much as you're doing the work on the ground, you also have to really make sure that you are partnering with government to get these things to be kind of institutionalized in a positive sense, in the sense that they become, if you're training healthcare workers as we do, are they being remunerated enough? Dr. Tedros just spoke about this, right? So you can't expect healthcare workers to go put their health and well-being on the line and then not make sure there's schools for their children to go to, houses for them to live in, and that they're paid enough to have a good, decent living wage that is worthy of the work that they're doing and that they can survive on it. And so working with governments to think about what does that whole picture look like? Or if you're training people, to make sure that you're not training them into a void to be jobless, but that you're training them to a job where they can be hired. And at SEED, we've very much tried to do that. So in northern Uganda, for example, we partnered with the government to help train midwives. And we help open the doors of the School of Midwifery. And at the end of, we've helped graduate 2 classes of midwives now, and all 100% of them have jobs. And a lot of them have stayed in the North and are working. And I think that's really important, is to look at the system that you're working in and to think about how you troubleshoot the system or make partnerships in the places that you don't necessarily have the expertise. Regulation is going to play into this too. You got to make sure that those systems are in place also to support the work that's doing. So I think that's important. I also think that what's really important is we have to stop looking for panaceas. We often are looking for some silver bullet to invent ourselves out of a problem. This is about actually putting in the proper deep systems that take time, resources, and commitment to actually solve the problems. But if we are not going to have 2 standards of care that we see in the world today, if we are not going to say, well, it's good enough for, this gets a little bit better in Africa, so we might as well do it. No. The places that we work in Africa deserve exactly the same quality of healthcare that I get. And until we achieve that, we should not stop short. And I think that means, though, you have to have the healthcare workforce you need the infrastructure you need the supplies you need. There has to be willingness to put in the resources. And we have to realize we can't do it on the cheap. And we're not going to do it in 1 or 2 or 3 years and just be able to report back and say we achieved it. We have to be willing to put in the hard work and the resources, and to know that if we do that, then you will see an economy that can grow because you have a thriving healthcare workforce that is safe and people who can stay in school, and you're not spending billions on treating a healthcare problem. You're spending less to prevent it. And then you can see that the governments are going to be able to afford their health systems. There is data that supports this. We just haven't been willing to put in the time, the resources, the commitment, or I think thought holistically enough. And I don't mean that pessimistically. I mean that from a place of profound optimism that there is a way for us to do this. We just have to decide we're going to.
Thanks, Vanessa. Temi, what are your thoughts?
Absolutely. I completely agree with Vanessa and Taryn and everything they've said. I think for me, what is really critical is building flexible and resilient health systems. Building the system itself that's flexible, resilient, and that, to be quite honest, meets the need that the last mile, the folks in the last mile actually believe they have. If we are able to deliver, vaccines for COVID-19, and we get it to the very last mile, and we're talking to a woman who knows that our neighbor's kid died from diarrhea, and she knows that, our child is most likely going to get, is more susceptible to dying from pneumonia. And she knows that, malaria is a concern from our sister-in-law who maybe died. And she knows that, another, sister-in-law somewhere died from postpartum hemorrhage. Folks know what the problem they have with their health system is. And for us, we as a global community don't solve don't build these resilient, flexible systems that can solve all these critical medical emergency for the last mile, it wouldn't work. And because it is, folks will think to themselves, this is what I care about, COVID is great, but maybe I'm not at risk for COVID. So maybe I don't want your vaccine. But if we are able to say, okay, this is the place that is excellent, that has been built, that can deliver excellent healthcare to you and your child, that can solve the problem you have, but also allows you to prevent this, COVID-19, then it's important that people will see that and say, okay, they're responding to my need, and then understand, and there will be a shared sense of a purpose. And, we wouldn't need to spend a ton of time and a ton of effort trying to talk people into uptaking this vaccine. So for me, I think what is really critical is building the resilient health system that would really deliver value to the people. And for us, for LifeBank, it is building that supply chain engine, investing in building that supply chain engine. For if another COVID hits, if any other medical emergency comes, there's already something in place that can respond to that medical emergency. If LifeBank was not around, if LifeBank was not in existence, when COVID hit Nigeria, we would have built, the first mass testing center. We would get oxygen to Nasarawa, oxygen to Kano, oxygen to, we would have done that. So, it was the pre-investment in LifeBank that allowed us to actually respond to COVID-19. So my main thing is, and my main call for the global health community is to work with us, invest in systems like LifeBank that solves all the critical issues that health system in developing countries have, so that when the emergency hits, there is someone there who already has the capacity, the knowledge, the focus, and the investment. And we've already built the system we need to reach the last mile. So for me, I think that's the call. Invest now. When COVID leaves, we'll still be there. We'll still be working. We'll still be distributing. If something else comes up, we'll be able to respond to those medical emergencies because you've invested in us, because we've built that system that can respond to these pandemics. Yeah.
Thank you, Temi. I think that was such an important note to end on, and for something for all of us to keep in mind. I want to turn now to the audience Q&A because I see a lot of really great, exciting questions coming in here. Taryn, I wanted to direct the first one to you. So you talked a little bit, building off of what Temi was saying about last mile delivery of vaccines. You talked a little bit about, okay, we need to also be thinking about the packaging because you don't want a big box. It might have to go in a drone. So similar to that, we have a question from Faith. Is there any consideration around a vaccine that wouldn't depend on a cold chain to get to where it's going?
Well, Faith, that's a great question, and innovation is really being pressure tested during COVID. I'm not aware, but that doesn't mean that we're not talking about, let's say, refrigerator stable vaccines were the goal maybe a few years ago. And that was a lofty goal because we were coming from frozen vaccines, which are very difficult. But to have a vaccine that doesn't require a cold chain at all, of course, I think that would be, absolutely remarkable. And these types of questions and this type of solve environment where the health authorities, the regulators, the developers are learning about what's in the pipeline and what you all are thinking about helps us then to be able to consider the future and consider what that last mile can look like. So although I don't have an answer to your question, I'm sure it's being looked at somewhere, but these types of questions keep us on our toes and then can actually help shape the development paradigm. Thank you.
Thanks, Taryn. Thanks, Faith. So, Vanessa, this question is for you and is about the global immune system that you're working on building. This comes from Anthony. So his question is, great that you're thinking about that, but how do we handle vaccine nationalism? So we don't necessarily, as we're developing vaccines, that doesn't necessarily translate to affordable pricing globally. What are you doing about that? How are you thinking about intellectual property concerns, control of manufacturing scale up? All of that has to be resolved so that we can worry about the last mile. And this might actually be a question not only for Vanessa, but also for Taryn and maybe also Temi.
Yeah, I mean, I think it's a question for all of us to solve, because you articulate, thank you for the question, you articulate a series of things that I think we're all struggling over. So some of the efforts around specifically the vaccine as a global public good and some of the folks that we're working with on this, there's a number of ways that I think that folks are trying to solve for this. And Gavi, for example, has done a really interesting project where they basically created a fund, an innovation fund that they're inviting countries to buy. And Gavi's the Global Alliance for Vaccination and Immunization. And so they have created a fund, which I think is the right way to potentially do, which is that if you buy into the fund, much the way the Global Fund was created for HIV, which is to say you're too small of a market to control the billions of dollars needed to innovate a vaccine and own that vaccine. But what if you buy into a fund? And by buying into the fund, we're creating a pool of money to create a global market to invest into a bunch of vaccine options, because we're going to need more than one vaccine, right? To solve this, we're going to need multiple vaccines that come out to be able to scale and distribute fast enough, ideally over the next period of time. And so they say, then once we get some winners in this, you'll have access to the winners because you've invested in it. And the idea would be to get every country into it, right? It's in everybody's best interest to do that. And I think that approach has been helpful in terms of getting governments to buy in, to create a bit more of a global market, to stimulate innovation and production. I think that there's a lot of questions in your questions, so I probably won't be able to hit all of them, but I'll try to hit some of the highlight ones. The most important thing for me is to help articulate the reason why the vaccine should be a global public good and why vaccine nationalism is ultimately going to fail your country. Because people are going into this with a narcissism, again, that if they vaccinate their country only, that's the solution. Everybody can travel and you'll be safe and you can go to, leave the US and go to France on holiday and you'll be okay. There's a couple of flaws here that need to be explained. One, we don't know. We think the vaccine is going to be 100% effective. We will not know until we really get this up at scale, and that we know, how this actually looks across different populations and different groups and different, and what it looks like when we're actually operating in a world where we have enough people vaccinated to understand how effective it is going to be. And so running around, thinking you're vaccinated and you're all good, hopefully that'll work. But if it doesn't, you're not going to be in any good shape unless the virus has been suppressed at a baseline rate across populations. Second of all, if you're a company, let's say you're a Coca-Cola and you're manufacturing around the world, your headquarters might be in the US, but if the US is immunized, you're still not producing Coca-Cola in Indonesia, in Africa, in China, in many parts of the world. If you're a manufacturing company and you're getting your raw materials somewhere in Africa, you're not manufacturing. If your production lines are in Southeast Asia, you're not producing. We now exist in a world that has the largest population ever in history, that is more dense ever than history, that has climate change on a background now, and that is globalized. And that's what makes COVID partially unprecedented. So it's naive, but we have to explain this to people. And so I actually have always wanted to get private sector to make this argument to some of the big multinational companies, to get them then to pressure their home governments to say vaccine nationalism isn't going to work. We are in COVID globally, and I wish I had the graphics to show you what the spread of COVID has looked like over the last 6 months. COVID is a global problem. The solution is a global solution. There is no way out of this than to realize we are as vulnerable as our weakest neighbor. And if the moral and the human argument isn't enough for you, then there is an argument for self-interest that I think can be used. And I'm happy to use that pragmatically. I am an optimist, and I fully, though, am ingrained in an idea that every human being deserves access to opportunity and to health and to well-being. But I will be completely pragmatic about how we get there if I have to be. And so I think that the arguments just haven't been made strong enough. Equally on the IP, I think that there are clauses in the WTO and the Doha Agreement and things like that will allow for production of vaccines in India and elsewhere where the production capability is to be manufactured. And again, the ability to leverage those patents is going to be very critically linked to making the argument about why this is in everyone's best interest to get a certain rate of suppression of the vaccine. Of the virus across the board. So it's a terrific question. It's a very long and complex answer, and I hope that at least there's the basic thing, but it comes down to making the argument of self-interest and getting a bunch of unlikely allies to come to the table to help make those arguments and to create the influence that is needed. But I think we have found that those governments and those leaders that have thought more holistically, more proactively, and been more aggressive have led their countries to a better place. And I think that vaccine nationalism is only going to backfire if we're that arrogant.
Thanks, Vanessa. Taryn, would you add anything to that from a regulatory perspective?
No, I would. I think that vaccine nationalism is exacerbated when there are fears about supply. And one thing that I've seen during this pandemic, and you can read about it in the news every day, are the incredible innovations in partnering amongst, pharma companies, amongst, let's say, academic institutions with pharma to try to advance this whole cascade of vaccines. And I do agree, there will be a need for all different types of vaccines against COVID-19. And just this partnering is so gratifying to see. So I'll add a positive note as a way to try to negate vaccine nationalism, and that is more secure supply. And then also something that, Vanessa, you've spoken about, and that is the rollout of the vaccine. Where should it go first? How should we do that? Protecting our healthcare workers is one idea that has always been at the forefront. So, making sure that the distribution and the availability of the vaccine is there. So thank you.
Thanks, Taryn. Temi, this is one for you. It comes from Alina from Pakistan. And I think it builds on some of what you started talking about earlier in terms of vaccine uptake and how we kind of build trust in our health systems in the last mile. So she asks, what suggestions do you have on how to promote vaccination or delivering vaccination and other medical goods to the last mile in a culturally sensitive way?
I think that for me, I always believe that value matters. For us, one of the reasons why we operated as a business is because we wanted to ensure that the work we were doing was valuable to the people, to our direct beneficiary. That even if you have, 10 cents, if you think that the service we're providing is valuable, are you willing to give half of that cent to us in order to get that value? So it's always been important to us to confirm that what we're doing is absolutely valuable to our direct beneficiaries. So I think I always trust in people. I think that no matter how poor people are, they understand what matters to them. And I think if we have frank conversations with people to say, what are the problems? Okay, so you don't care about this vaccine, but what are the problems you care about? And if people sense that we care about what they care about, that we have built a system to solve the problems they think is killing their children, then they will trust us when we bring critical vaccines to them. So solving problems in the last mile is an important way of building trust with people who live in the last mile. So that when vaccine time comes, when it's time to vaccinate, we don't have to do this major hard sell. They already trust us. They trust this institution because that's where their child was cured of pneumonia. That's where they got oxygen for their kids. That's where they got malaria drugs for their kids. That's where their kid was helped with the diarrhea the child had. That's where their mother-in-law, survived postpartum hemorrhage because blood was available in this institution. So they will build natural trust with these institutions. And when trust is present, anything that is important can be introduced in a seamless way. So for me, I think one critical insight that I have that I've always held on to is no matter how poor people are, they know what's best for them. And if we build trust with them, they will in turn trust us when it's time to vaccinate. So I think for me, that is one way. Trusting people is the right thing to do. And it also guarantees cultural sensitivity, because when you have frank conversation with people and you take their problems seriously, it's respect, and everybody wants to be respected. Everybody wants to have dignity. And I think that is really, really the cornerstone of ensuring that people are open to being vaccinated.
Thank you. So we have time for one last question from the audience, and I'm not sure who this would go to, but I think it's just so important for us to address, so you can jump in. Manan, and sorry if I'm mispronouncing your name, is asking, how can we tackle mental health issues in the midst of the pandemic? And I think this is something, whether or not each of us is personally healthy or not, I think we're dealing with economic issues at the moment. We're dealing with issues in our social networks, in our families. Our general baseline level of stress is higher. We're practicing social distancing, hopefully. And so, I think more people are lonely, are stressed, are anxious. What should we be doing about this? How should we be thinking about this? Are there solutions?
I'm happy to take a crack at it. First of all, I really appreciate the question. My mother was a huge mental health advocate starting back in the 1980s when people wouldn't talk about depression. And I think that I grew up in a house that really recognized the power and importance of recognizing our mental health as part of our well-being and our overall health. And the WHO actually defines health now as it really including mental health. And it's responsible for about 1/3 of our morbidity and mortality. And what we're now suffering, though, is global trauma. This is traumatic. We've had our whole world, for many, this is traumatic, where our world has been upended. For some, they're living trauma every day in one form or another, just by the nature of where they were born or what their experience was. Sorry about the background again. So I think that mental health is critically important. And at SEED, we've actually tried to prioritize partnering around training mental health practitioners in some of our countries because there's such a need to scale up mental health. But we should be integrating it into our primary care systems in general. We should be learning to talk about it, destigmatizing it, and finding ways to create community, even as we socially distance, physically distance, but still trying to create community in this moment, and encouraging people to kind of talk about what's happening. So I think that this is an example where I think getting engaged with your policymakers is really important so that it's on their radar, so that there's prioritization of resources, funding, and thought about how you include this into programming. I think that there have been creative ways where programs that do provide support to the last mile can find ways to also think about how do you integrate some basic screening questions, or again, creating community and shared purpose. I worked in Rwanda for a long time, and part of their recovery from the genocide was Gacaca, which was a system of bringing the community together into accountability, to talk about what happened, to confront your neighbor, to really open up the wounds, but embrace them and try to heal as a community. And I think that as we talk about what's happening with COVID, that's going to be important for us too. But the first step is to ask questions and to reach out and to understand. This is another example where we have a global problem and it's a global solution. It's by seeing ourselves as a community. We are tied to one another in one way or another. And I think that it's important for us to understand that, and to understand that we are all suffering in some way, differently, and to be able to talk about that, to share and to embrace. But it also means committing the resources to building the training and building those systems that can provide that kind of support. And the one thing I will say that at SEED Global Health, we've been working to make sure that mental health is included in our work and our training, because it is such a critical important of our ability to take care of our whole, our family, ourselves, our systems. It's going to involve all of us finding it as a priority.
Thank you so much. And a huge thank you to all of our panelists for joining me today for Solving from Anywhere.
Thank you for having us.
Thank you.
Thank you. So I hope that everybody enjoyed today's discussions as much as I did. If you were impressed by Temi's work and you're interested in supporting more social entrepreneurs like Temi and like LifeBank, please let us know. We would love to hear from you. And of course, we hope that you'll join us for future Solve events as well. Don't forget to stay tuned for tomorrow's announcement of the finalists for the 2020 Global Challenges, which will come to you via your inbox in our newsletter. And I know that I'm really looking forward to seeing all of our finalists pitch at Solve Challenge Finals, which is again happening virtually on September 29th. So hope to see you there as well. If you'd like to learn more about how to attend and join as a member, please reach out. We would love to connect. In the meantime, please take a few moments to just fill out our post-event survey, which you'll find in your email and then also in the chat right now. Those responses really help us figure out how to make this series better. So do submit them. Thank you, stay safe, and happy solving.